Good day, I am John Luluquisen, a student nurse, and today I am going to perform the procedure for assessing the breast and the axilla of the client. First, we have to assemble our equipments, which are the following: our centimeter ruler, our clean gloves, and also, if there will be any discharges coming from the client's nipples, we will be needing a kidney basin. Now, we can proceed with the procedure. Good day, ma'am. I'm John Luluquisen, your student nurse for today. Ma'am, can you please state your name and your date of birth? Okay, so thank you, ma'am. So today, ma'am, I will be assessing your breast as well as your axilla. Later, I will be asking you to undress for me to fully inspect and palpate your breast and your axillary area for any abnormalities. So is that okay, ma'am? Okay, so then we perform proper hand hygiene and observe other appropriate infection control procedures. Before attending to the client, I have already washed my hands. Now, I will put on my clean gloves. Now, we also have to provide for client's privacy, especially that the client will be exposing her breast area later. So we will do that by ensuring that the doors are closed, or if we are in a ward, the curtains or the movable curtains are properly closed as well. So now we can start asking important questions to the client. So ma'am, I will be asking you questions that are essential for the assessment. Okay, so first, ma'am, have you experienced having any breast masses during the past, ma'am? So, if you have experienced having breast masses, ma'am, what did you do about those breast masses? Okay, so also, ma'am, can I ask you if have you felt any pain or tenderness that you think is related to your menstrual cycle? Okay, so also, ma'am, have you observed any discharges coming from your nipples? Okay, so none. Okay, so also, ma'am, are you taking any medications right now? Have you undergone estrogen replacement therapy? Oh, okay, so ma'am, may I also ask if you have any close relatives, or for example, your mother, your sister, or your aunt who is suffering from breast cancer? Okay, that's good to hear, ma'am, that there are no breast cancer patients in your family. Okay, so ma'am, do you consume alcohol? Oh, okay. So, how how often and how much do you drink? Okay, so what about your usual diet, ma'am? Do you consume high-fat meals? Okay, so also, ma'am, may I ask if you have any close relatives who is obese? Okay, so ma'am, did you or have you used any oral contraceptives during the past? Okay, so ma'am, may I also ask if your menstruation period started before the age of 12? Okay, so no. What about your menopausal period, ma'am? Did it happen after the age of 55? Okay, so do you have any children, ma'am? Did you give birth after the age of 35? Okay, so no. Lastly, ma'am, have you tried the technique self-breast examination? Okay, so after asking those questions to the client, we can now proceed to the inspection of the client's breasts. First, we assist the client, or we tell the client to undress. Okay, so ma'am, I will be asking you now to undress, please. Okay, so assist me now to undress. Now, I am inspecting the breast of the client for the size, the shape, as well as the symmetry. Okay, so while the client is in the sitting position. Also, I am inspecting the skin of the breast area of the client, and I am looking for any localized discolorations or hyperpigmentations. Also, we will be looking for any retraction or dimpling as well as redness. Okay, so we also have to look for swelling or edema. Okay, so also we have to emphasize any retraction if there is or if there are. Okay, so first, ma'am, please raise your hands over your head like this. Okay, so when the client raises her hands, we have to inspect for any retraction. Also, ma'am, please push your hands together and your elbows slightly flexed like this. Okay, so. And finally, ma'am, please place your hands on your hips. Okay, so. After that, we continue the inspection of the areola of the client. So first, ma'am, I will be measuring your areola. Excuse me, ma'am. Okay, so also, we have to inspect for the size, the shape, as well as the symmetry of the client's areola. We also have to look at its color, the surface characteristics of the areola, and we also have to note if there are any masses or lesions around the client's areola. So far, the client's breast and the client's areola looks normal. Okay, so also, we have to inspect the client's nipple. We have to look at the size, the shape, and the color, the position. We also have to inspect for any discharges as well as lesions. Now, we have to palpate the lymph nodes of the clients. So first, we have to assist the client in a position wherein the client's arms is supported by our forearms. Also, in the palpation part, we will be using our fingertips, the finger pads of our fingertips for palpation. We will palpate the 4 areas of the axilla, which are the following: the edge of the mid or the greater pectoral muscle along the anterior axillary line, also the upper part of the humerus, as well as the thoracic wall in the mid-axillary area, and lastly, the edge of the latissimus dorsi muscle or the anterior edge of the latissimus dorsi muscle along the posterior axillary line. Okay, so ma'am, please place your arms over my forearms. Now we will start palpating the lymph nodes of the clients or the client. Start here. Okay, so now I'm palpating the clavicular lymph nodes of the clients. Okay, the upper part of the humerus. And also the posterior axillary line. Okay, so after palpating the lymph nodes of the clients, we now have to continue palpating the breast of the client for any masses, tenderness, or discharges from the nipples. So first, we assist the client to a lying position. So ma'am, I will assist you now to a lying position. Okay, so in the palpation of the breast of the client, we can use 3 different techniques. It can be circular, the wedge, or the vertical strip pattern. But today, I will be using the circular pattern. Okay, so we start palpating again using the finger pads of our fingertips. We started on the axillary area. Okay, so now I'm palpating the axillary area of the client, and slowly I am moving around the client's breast. Okay, so we have to make sure that we palpate for the full breast. We palpate the full breast of the client. Slowly. Okay, so ma'am, please don't hesitate to report if you feel any pain while I'll palpate your breast. Okay. Moving around the client's breast. Okay, so the client's breast feels normal. There are no any tender parts. Okay. After palpating the other breast of the client, we now move to the other side of the other breast of the client by repeating the steps again. Okay, so we start again in the axillary area and then moving around the breast of the client. Slowly we palpate. so again, ma'am, please report any pain if you feel, or please report if you feel any pain. Okay. Also, to this part of the breast of the client, okay, does not feel tender. After palpating the breast of the client, we have to continue palpating the client's areola and nipples for any discharge. Okay, so first we compress the areola and the nipples of the client, and if there is or if there are any discharges, we have to milk the breast of the client along the radius to identify the discharge producing lobe. Okay, so also we have to assess, or we have to, yes, we have to assess the discharge for its color, the amount, also the consistency, as well as the odor of the discharge. We also have to note for any tenderness during palpation. So during the palpation of the client, there are no tenderness palpated. Okay, there are no tender parts that are felt. Okay, so now we have to assist the client to put back his or her dress. Okay, so ma'am, I'm now, okay, so then we assist the client again to a sitting position, and we have to teach the client the technique for proper breast self-examination. And after that, we have to document any findings in the client's record. That is it for the assessment of the breast and the axilla of a client. Thank you.